Varicose veins are a well-known issue, often associated with aging or genetics. However, what many may not realize is the significant impact it can have on certain professions, particularly nursing. The long hours spent on their feet, constantly moving and standing, can take a toll on their vascular health. To gain deeper insights, we're privileged to have with us today Shannon Kane, a nurse who has been battling varicose veins for years. I'm Mihiraa. Thank you for joining us.
Thank you for having me.
Could you briefly share your journey with varicose veins and how it has impacted your life and career as a nurse?
Certainly. I first noticed the symptoms during my early years of nursing, experiencing discomfort and swelling in my legs after long shifts. Over time, it progressed, affecting not just my physical health, but also my ability to perform certain tasks efficiently. It's been a challenging journey, to say the least.
It's clear that varicose veins can pose significant challenges for nurses like yourself. How prevalent would you say this issue is among your colleagues in the nursing profession?
Mihiraa, it's more common than one might think. Many of my fellow nurses also struggle with varicose veins, and it's not surprising given the nature of our work. The constant standing and movement put immense pressure on our veins, making us more susceptible to developing this condition.
That's indeed concerning. It highlights the importance of raising awareness about the impact of varicose veins on nurses' health and well-being. Thank you, Shannon, for sharing your experiences with us.
Thank you for having me. It's my pleasure to shed light on this important issue.
Varicose veins can significantly affect the lives of nurses, both personally and professionally. It's essential for us to recognize the challenges they face and work towards finding solutions to support their well-being. Moving on, we're joined by Dr. Philip Karen to discuss why nurses are particularly at risk for varicose veins. Dr. Karen, thank you for being with us.
It's my pleasure, Mihiraa. Thank you for having me.
Let's delve into the factors that make nurses more susceptible to varicose veins. One of the primary contributors is prolonged standing. Dr. Karen, could you elaborate on how standing for long hours affects nurses' vascular health?
Surely, Mihiraa. Nurses spend the majority of their shifts on their feet, attending to patients' needs. Prolonged standing impedes blood flow in the legs, leading to increased pressure on the veins and potentially causing them to dilate and become varicose.
That sounds incredibly challenging. In addition to prolonged standing, limited mobility is another factor. Could you explain how this lack of movement exacerbates the risk of varicose veins?
Absolutely. Limited mobility restricts muscle contractions that assist in pumping blood back to the heart. Without adequate movement, blood can pool in the lower extremities, contributing to the development of varicose veins.
Another aspect of nursing that often goes unnoticed is the physical strain involved, such as lifting heavy objects. How does this contribute to the prevalence of varicose veins among nurses?
Mihiraa, lifting heavy objects increases intra-abdominal pressure, which, in turn, raises pressure within the veins of the lower limbs. This added strain on the vascular system can accelerate the formation of varicose veins, particularly in occupations that involve frequent heavy lifting, like nursing.
Additionally, pregnancy, which is more common among women, is another risk factor for varicose veins. Could you shed some light on why pregnancy increases the likelihood of developing this condition?
Yes, during pregnancy, hormonal changes and increased blood volume place additional pressure on the veins, especially in the lower body. This, coupled with the added weight of the growing fetus, can weaken the vein walls and valves, making pregnant nurses more susceptible to varicose veins.
It's evident that nurses face multiple challenges that put them at risk for varicose veins. Are there any studies or research findings that highlight the prevalence of this condition among nurses?
Indeed, Mihiraa, numerous studies have shown a high prevalence of varicose veins among nurses compared to the general population. For example, a recent study published in Health Journal emphasizing the significant impact of occupational factors on nurses' vascular health.
Thank you, Dr. Karen, for sharing your expertise on this topic. It's crucial to recognize the unique challenges nurses face and take proactive measures to support their vascular health.
My pleasure, Mihiraa. I'm glad we could shed light on this important issue.
Now, let's delve into how varicose veins can affect nurses in their daily work. Joining us for this discussion is Viola Call, a senior nurse manager with extensive experience in the field. Viola, thank you for being here.
Thank you for having me, Mihiraa.
Let's start by addressing the immediate impact varicose veins can have on a nurse's ability to perform their duties. Could you elaborate on how discomfort and pain associated with varicose veins can hinder mobility and task performance?
Absolutely, Mihiraa. Varicose veins can cause significant discomfort, including aching, heaviness, and swelling in the legs. For nurses who spend long hours on their feet, this discomfort can become debilitating, making it challenging to move around and carry out essential tasks efficiently. Simple actions like standing for prolonged periods or walking between patient rooms can become increasingly painful, affecting both productivity and quality of care.
That sounds incredibly challenging. Beyond immediate discomfort, are there any potential long-term consequences nurses should be aware of if varicose veins are left untreated?
Yes, indeed. Varicose veins can progress to more serious complications if neglected. For instance, they may lead to chronic venous insufficiency, where the valves in the veins fail to function properly, causing blood to pool in the legs. This condition can result in skin changes, ulcers, and even deep vein thrombosis, posing significant risks to a nurse's health and ability to work effectively.
It's clear that varicose veins not only impact a nurse's physical well-being, but also their ability to provide optimal care to patients. Viola, what measures can nurses take to mitigate the effects of varicose veins and ensure they can continue their work without significant hindrance?
Nurses should prioritize self-care and take proactive steps to manage their vascular health. This includes wearing compression stockings, practicing regular leg exercises, elevating their legs when possible, and seeking medical attention if symptoms persist or worsen. In addition, creating ergonomic work environments and rotating tasks to minimize prolonged standing can also help alleviate discomfort and reduce the risk of complications.
Thank you, Viola, for sharing your insights on how varicose veins impact nurses and the importance of proactive measures to maintain their well-being.
It's my pleasure, Mihiraa. I hope our discussion encourages nurses to prioritize their vascular health and seek support when needed.
Continuing our exploration of living with varicose veins, we're joined again by Shannon, a nurse who graciously shared her experiences earlier in the episode. Shannon, thank you for being here once more.
Thank you, Mihiraa.
Shannon, could you share a bit about your personal experience living with varicose veins and how you manage the condition while working as a nurse?
Mihiraa, living with varicose veins has been a journey filled with challenges, both physically and emotionally. The discomfort and pain can be quite overwhelming, especially during long shifts on my feet. However, I've found ways to manage the symptoms, such as wearing compression stockings, practicing regular leg exercises, and taking short breaks to elevate my legs whenever possible. Additionally, staying hydrated and maintaining a healthy lifestyle have been crucial in managing the condition effectively.
It's inspiring to hear how you've taken proactive steps to cope with varicose veins while continuing your work as a nurse. Do you have any tips or advice for other nurses who may be dealing with similar challenges?
Absolutely, Mihiraa. Firstly, I would encourage nurses to prioritize self-care and listen to their bodies. It's essential to recognize when you need to take breaks and not push yourself too hard, especially when experiencing discomfort. Secondly, don't hesitate to seek support from colleagues, supervisors, or healthcare professionals. There are various treatment options available, and it's important to explore what works best for you. Lastly, remember that you're not alone in this journey. Many nurses face similar challenges, and sharing experiences and strategies can be incredibly helpful in navigating life with varicose veins.
Thank you, Shannon, for your valuable insights and for sharing your journey with us. Your resilience and determination are truly commendable.
Thank you, Mihiraa, for providing a platform to discuss these important topics.
Dr. Philip Karen, what varicose veins are in simple terms? Could you break it down for our audience?
Of course, Mihiraa. Varicose veins are swollen, twisted veins that usually appear blue or dark purple in color. They occur when the valves inside the veins weaken or fail, causing blood to pool and the veins to enlarge. Varicose veins commonly develop in the legs and can range from minor cosmetic concerns to more serious health issues.
Thank you for that clear explanation, Dr. Karen. What are some symptoms that individuals with varicose veins might experience?
Individuals with varicose veins often experience symptoms such as aching, heaviness, or cramping in the legs, especially after long periods of standing or sitting. Swelling and inflammation around the affected veins are also common, along with visible bulging or twisted veins under the skin. In more severe cases, individuals may develop skin changes, such as discoloration or ulcers, near the affected veins.
It's essential to recognize these symptoms and seek medical attention early on. Dr. Karen, why is early diagnosis and treatment of varicose veins important?
Mihiraa, early diagnosis and treatment are crucial for preventing the progression of varicose veins and managing symptoms effectively. Left untreated, varicose veins can lead to complications such as chronic venous insufficiency or venous ulcers, which can significantly impact an individual's quality of life. Seeking timely medical advice allows for appropriate interventions to be implemented, reducing the risk of complications and improving overall vascular health.
Now, let's discuss the various treatment options available for varicose veins if they develop. Dr. Karen, could you briefly outline some of these options?
Mihiraa, treatment options for varicose veins may include sclerotherapy, where a solution is injected into the affected veins to close them off, laser treatment to heat and seal the veins, or in severe cases, surgical procedures such as vein stripping or ligation. The choice of treatment depends on the severity of the condition and individual patient factors.
Thank you, Dr. Karen, for explaining these treatment options. And to our listeners, remember the importance of consulting a doctor if you suspect you have varicose veins. Early intervention can make a significant difference in managing this condition effectively. Up next, we're joined by a distinguished healthcare professional, phlebologist Milton Liu, to discuss an essential topic: preventing varicose veins, especially for those in high-risk professions like nursing. Dr. Liu, thank you for joining us.
Thank you for having me, Mihiraa. It's a pleasure to be here.
Let's dive right in. Nurses, with their demanding and often physically taxing work, are at increased risk for developing varicose veins. What are some practical tips you would offer to nurses to prevent the onset of this condition?
Absolutely, Mihiraa. Nurses can take several proactive measures to reduce their risk of developing varicose veins. Firstly, wearing compression stockings can provide valuable support to the veins, helping to improve blood circulation and reduce the likelihood of vein dilation. Additionally, taking regular breaks to elevate the legs can alleviate pressure on the veins and promote healthy blood flow back to the heart. Maintaining a healthy weight through proper diet and exercise is also essential, as excess weight can exacerbate strain on the veins. Nurses should prioritize regular exercise, with a focus on activities that promote leg movement and circulation, such as walking, cycling, or swimming. Lastly, Encouraging good posture while standing and sitting can help prevent unnecessary strain on the veins and promote overall vascular health.
Thank you, Dr. Liu, for those valuable tips. These simple yet effective strategies can make a significant difference in preventing varicose veins among nurses. In your experience, how effective have these preventive measures been in reducing the incidence of varicose veins among healthcare professionals?
These preventive measures are indeed highly effective when consistently implemented. I've seen firsthand how nurses who prioritize their vascular health by wearing compression stockings, taking breaks to elevate their legs, and engaging in regular exercise significantly reduce their risk of developing varicose veins. By incorporating these practices into their daily routines, nurses can not only protect their own well-being but also ensure they can continue to provide quality care to their patients without being hindered by vascular issues.
That's encouraging to hear. It emphasizes the importance of proactive self-care among healthcare professionals. Dr. Liu, before we conclude, is there any additional advice you would like to offer to nurses or anyone else looking to prevent varicose veins?
Well, Mihiraa, I would simply reiterate the importance of consistency and mindfulness in implementing these preventive measures. By making these practices a priority in their daily lives, nurses can significantly reduce their risk of developing varicose veins and maintain optimal vascular health throughout their careers. Additionally, regular checkups with a healthcare professional can help identify any early signs of vascular issues and allow for timely intervention if needed.
Thank you, Dr. Liu, for sharing your expertise and insights on preventing varicose veins. Your advice will undoubtedly empower nurses and others to take proactive steps in safeguarding their vascular health. As a bonus segment, we're fortunate to have Mihiraa Cobb, an expert in workplace ergonomics, join us to discuss strategies for nurses to minimize prolonged standing and improve circulation during their demanding shifts. Mihiraa, thank you for being here.
Thank you for having me, Mihiraa. It's a pleasure to be part of this discussion.
Let's jump right in. Nurses often spend long hours on their feet, which can take a toll on their vascular health. What ergonomic strategies would you recommend to help nurses minimize the negative effects of prolonged standing?
Absolutely, Mihiraa. One effective strategy is to provide nurses with anti-fatigue mats in areas where they frequently stand, such as at workstations or beside patient beds. These mats offer cushioning and support, reducing pressure on the feet and legs and promoting better circulation. Additionally, incorporating adjustable height workstations allows nurses to alternate between sitting and standing throughout their shifts, helping to alleviate fatigue and strain on the lower body.
Those are excellent suggestions. What about techniques to improve circulation and reduce the risk of vascular issues during long shifts?
Mihiraa, one simple yet effective technique is encouraging nurses to perform regular leg exercises and stretches during breaks. These exercises help stimulate blood flow and prevent blood from pooling in the lower extremities. Additionally, promoting proper footwear with adequate support and cushioning can also help improve circulation and reduce discomfort. Finally, implementing scheduled rest breaks where nurses can elevate their legs for a few minutes can provide much-needed relief and allow for better venous return.
Thank you, Mihiraa, for sharing those valuable insights. These ergonomic strategies not only prioritize nurses' comfort and well-being, but also contribute to a safer and more efficient work environment. Before we conclude, is there any additional advice you would like to offer to nurses or healthcare facilities looking to improve workplace ergonomics?
I would emphasize the importance of ongoing communication and collaboration between nurses and management to identify and address ergonomic concerns effectively. Mihiraa, by listening to the needs and feedback of frontline staff, healthcare facilities can implement targeted interventions that promote both employee health and productivity.
Thank you, Mihiraa, for your expertise and thoughtful recommendations on workplace ergonomics for nurses. Your insights will undoubtedly help foster healthier and more supportive work environments and healthcare settings. That concludes our bonus segment. Remember, prioritizing ergonomic principles can make a world of difference in ensuring nurses' well-being and comfort during their demanding shifts. Until next time, take care and stay healthy.